Hey guys, okay, we just talked about AB. Now I want you to think AD, adduction, adding my legs to the midline. Let's think about a few situational factors here. So if I'm in AB and I'm returning to neutral, that movement is adduction, okay? But what muscles actually did that? If my leg is up here and I let my leg just fall without control, gravity did that. My muscles weren't really doing anything, right? But let's say I'm up here in abduction and I very slowly and with control return to neutral. Yes, this is adduction, but it's being performed by my abductors who are lengthening to allow my leg to return into this neutral position. Now, most of us, to be able to activate our adductor group, we need some type of resistance, unless I were to say, lay on the ground and do some Jane Fonda leg lifts, okay? If you cross the midline and think about squeezing your inner thighs together, you can feel those adductors. Or if you just simply drag your toe on the floor and palpate your inner thigh, you can feel those adductors kicking in. Okay, a lot of times we need resistance if we're standing upright to activate those adductors. Another thing, we did it today in class, rock a plie, squat, and squeeze those legs together, doing a little heel click a few times, and I promise you will feel those adductors activating. Now, if you look in your textbook, you will see that the adductor group is comprised of 5, but then if you look, there's a 6th muscle that helps out with adduction. So let's look at our adductor group first. Again, when we talked about flexion earlier, I told you to palpate those flexors, feel for the mush. That's where your triad, your femoral triad comes in, your femoral artery, vein, and nerve. And then if you go just medial to that, closer to the pubic bone, you can feel those adductors start. And you can palpate down and around right to the mid-thigh right there, the medial surface of your thigh, at the pelvis, and you can feel tendon after tendon after tendon. Those are your adductors, okay? So we have our pectineus, our adductor longus, right under the adductor longus, right there at the pectineus, that's your adductor brevis. You don't see that on models though. And then we have our adductor magnus. He's huge. He wraps all the way around from the front to the back. And then right there, dead center, superficial, parallel fibers. So we have the gracilis. The gracilis is a little crazy. He's very weak because he's parallel fibers. That's the weakest fiber formation. So he's going to span dead center in the middle of the thigh, medial thigh, dead center. Not anterior, not posterior. So he doesn't do anything with flexion. He doesn't do anything with extension. He adducts and internally rotates the hip. All the adductors also internally rotate the hip. But he's crazy because he actually crosses the knee as well. He distally attaches to the proximal medial tibia at a special location called the pes area. That's named for the shape of the tendon that attaches there to that medial surface of the knee. So if you feel your tibial tuberosity, there's mine, and I'm going just medial, go feel a little sensitive mush there. That's that tendon. Okay, it's actually a combo of 3 tendons that join together, and that's called the pes inserine tendon. Goose's foot. All 3 of them together, they look like that webbed foot. So that's where the gracilis, the sartorius, and the semitendinosus, all 3 of those converge together in that one tendinous junction at the pes area on the tibia. So here's my gracilis, and think if he's crossing medially at my knee, he's going to help with flexion. And he's also going to help with medial knee rotation. So he does quite a few things, but at the hip, he doesn't do any flexion, he doesn't do any extension. He's not like adductor magnus. All right, so let's find these on the thigh. So here you're looking at the anterior view. We've got our IT band here, so lateral. Now let's look medial. There's that mush. So here we're in hip flexor land. We feel the femoral triad there at the mush. Then we have our pectineus, our adductor longus, brevis is underneath there, gracilis, and then you can see magnus running from the anterior to the posterior. So those are the 5 adductors. Now, the 6th one The sixth muscle who's helping are the very bottom fibers of glute max. Go back to those little jump squats, those heel clicks we were doing, and I want you to think, what is your butt doing when you're doing these jump squats here, okay? Go wide. Like, that was okay, but I want you to go wide. And now I want you to click those heels together. What did you have to do to your glute max? The very bottom fibers, you had to squeeze. We used to say in cheerleading, pinch a penny. You're pinching a penny with those glute fibers, the very bottom glute fibers. You're squeezing your glutes together, okay? He's the sixth one that helps with hip adduction.